Hi, my name is Joshella, and this is going to be my public today. And today we're going to talk about the impact of animal health and well-being, human well-being. And this means the workforce and mental health crisis in the veterinary field. Let's start with a quick question. Have you ever thought of who is the one taking care of your pets, meaning the veterinarian, and what this title comes with? Veterinarians dedicate their lives to treating sick animals, comforting pet owners, and ensuring public safety. But behind their compassion and professionalism lies a growing mental health crisis that is affecting the entire field. According to a 2019 study done by Tomasi Susan with colleagues as well, veterinarians are significantly more likely to die by suicide than the general population. Many suffer in silence due to burnout, long work hours, and emotional fatigue. In today's presentation, I will focus on three main points: mental health crisis in this profession, workforce shortages, contribution to mental health challenges, and potential solutions to improve the overall well-being of this professionalism. My first main point will be talking about the mental health crisis in this profession. The mental health crisis in the profession medicine is not a new issue. It's been here for a long time. But the recent research they're mentioning that it's just getting worse year by year. The study done by Tomasi Susan with her colleagues in 2019 found that veterinarians have a higher suicide rate compared to general population. This is partly due to the compassion fatigue, the emotional exhaustion that comes from constantly for suffering animals and managing clients' grief. Another major factor is burnout. The ABMA in 2024, this means the American Veterinary Medical Association, highly how unreasonable time pressures, overwhelming caseloads, and financial strain have pushed many veterinarians to their limits. Many feel trapped between the love of their profession and the strength that it brings. To make matter worse, there's still stigma around seeking mental health care. Some veterinarians fear judgment from their peers or worry of losing their license. So now that we understand how serious the mental health challenges are, let's explore one of the biggest causes, the shortage of professionals in the field. It's currently this problem is already facing a national or even global shortage of professionals. According to the Robot in 2024, the demand of veterinarian care has been growing rapidly, especially since the COVID-19 pandemic. But the numbers of available veterinarians has not keep up. The shortage means existing staff are working longer hours, taking fewer breaks, and handling more clients than even before. The AVMA explains that unimaginable workloads and lack of work-life balance are now top reasons to burnout. Many veterinarians, especially younger ones, also carry large amounts to study that, adding financial pressure to already demanding career. When clients are short-staffed, where clinics, are short-staffed, the remaining employees have pressure to take extra duties, often at the expenses of their own health. Over time, this constant stress leads to exhaustion, anxiety, and even thoughts of leaving their profession altogether. If the problem is rooted in both of the health strain and the workforce shortage, what as the pet owners or simply humans we can fix through this? So let's see some of this potential solutions. So some of the solutions we have to address the crisis with individual and systematic solutions. First, mental health support must become a normal and encouraged part of veterinary practice. The AVMA recommends expanding confidential counseling programs and peer-to-peer support systems that allows veterinarians to seek help without fear or stigma. Or fear stigma or professional consequences as well. Second, workplaces need to prioritize health environment. That means manageable works, flexible schedules, supporting leadership, and team communication. Clinics should regularly check in on staff, not on the staff well-being and not just on their productivity. Third, the innovation in staffing can help reducing burnout. The RU and VED to 2024 suggests using relief or temporary staffing platforms that allows veterinarians to take time off while burn, burning others. Additional, increasing the number of veterinary students and improving retention can help reduce this workforce gap. By combining these strategies, mental health awareness, workplace reform, and staff innovation, this field can start moving towards recovery and sustainability. In conclusion, the mental health and workforce crisis in this veterinary medicine field is complex, but it's not impossible to solve. We've seen that veterinarians have faced the highest, one of the highest suicide rates among professionals. Also, short staff and overwhelming workloads make burnout worse, and meaningfully situations require action. For expanding mental health resources to reform workforce struggle structures. When we take care of our veterinarians, we also take care of the animals. And by extension, the people who love them, meaning us. So next time you bring your pet to the vet, remember compassion work both ways. Supporting those who heal our animal is an act of kindness that strengthens our entire community. This is some of the resources that I used to make this presentation, and thank you so much. Bye.